Hello, this is Dr. Alberto Rullan with Equine Performance Innovative Center and Performance Equine Veterinary Services in Ocala, Florida. Today, I am extremely excited to bring you my guest. My guest is Dr. Christopher Burnham, our equine chiropractor and people chiropractor as well. Dr. Burnham, so excited to have you here. Thank you very much for being here with us.
My pleasure. Thank you.
So we're gonna keep this very conversational, all right? So no nothing preset. We're just gonna start talking, and I want to go straight to. I have several things in my head that I want to talk to you about, but the first thing is, how did you do this switch from people to horses? How did you get into this chiropractic endeavor?
It started when I was a child. I had to make a decision as to what my career was going to be. And I was torn between being a veterinarian and being a medical doctor when I had an amazing experience with a chiropractor. And that really changed my life and my view, my focus of my life. And I always missed animals in my life. Been around animals and grew up around animals and had some amazing experience with animals. And I understand how the human relationship with animals affects people, which it means to them. And I had a tremendous career in human chiropractic. I wanted to expand on that into animals. And so I decided after an experience I had with a horse that I wanted to pursue it as far as I could. So I went ahead and did the postdoctorate certification through American Veterinary Chiropractic Association. And it has been absolutely amazing. It's changed my life, and my life was fulfilling before. I didn't know that my cup could overflow like this.
Wow.
It's really incredible.
Wow, that's awesome. Thank you for sharing. Thank you so much. So now back to the chase. Chiropractic work. For many, many years, when I went to vet school, that was a big no-no. We talked nothing about chiropractic. And it was sort of a taboo. Over the last several years, we have found out that it actually works. Figure, right? So how have you been able to overcome that from the people side and the horse side and the animal side? That's
a really important question. Part of the reason is there's a scarcity of research. There's research out there, but it's very scarce. But one thing that is very different about working on animals and working on humans is that there's no placebo effect with an animal. In a human, you can give 1,000 people with cancer a sugar pill and tell them it's going to cure them. It's a new drug, and 70% of them will be cured. You can't do that with a horse. You have to see it. You have to see the improved range of motion. You have to see the improved endurance. You have to see the improved behavior. And you can do that right away with chiropractic.
Why is that? Biomechanically, why is that?
Chiropractic, people like to summarize it and basically saying you're putting bones back into place. But really, what you're doing is you're changing how the animal interacts with the environment, working on its nervous system to help its nervous system adapt better to its environment so it can use its own bodily functions to help it heal better. Yes, it helps with pain. Yes, it helps with short-sightedness. Yes, it helps increase motion. But imagine that you have a knife stabbing in your back between your shoulder blades. It's shooting down your arms. The stress level you're in when somebody calls and tells you that there's a financial problem, a family problem, a personal problem, the stress that you're able to deal with is less because of how much your brain is focusing on that pain. And if you remove that pain and you can breathe and relax, somebody calls and tells you there's a problem, you're more focused and more able to focus on that issue at hand and deal with it better. And same thing with a horse. When they have a sore withers and there's a rider on them asking them to do something, that the dog barks, then a leaf falls, then a branch blows over and a tarp starts flapping, they're more likely to spook and not be able to do their job and not keep their focus than if they don't have that.
That's a great analogy. I love the stress analogy for both people and for horses. So how much do you see that you alleviate stress in the patient with chiropractic work?
I've had some cases that are absolutely miraculous. Can't call it anything else. I remember one particular lady I met at a rodeo in West Palm. She had a horse that she couldn't ride. She couldn't walk it down the street. Dogs barking. It was dangerous, and the horse really couldn't serve any job. It was too dangerous. And I looked at it and saw that it had a pretty significant fixation in its neck, and caused the horse to have a difficult time looking down. Now, my theory is with this that because the horse can't place its head properly, can't keep its awareness, it's a prey animal. It needs to be able to feel comfortable where it's at. And when it couldn't lower its head, it couldn't properly make sure that it was safe. And it created a stressful situation for the horse. And the horse was always head up and down like this. And adjusted it once, and she sent me a text message a few days later, walking the horse down the street. Dogs are barking, nothing, didn't even pay attention. And, there's, again, a scarcity of research in this and how much it affects behavior. But you can't deny things like this happen. It doesn't mean it's going to happen with every horse. Chiropractic does not work on every animal because not every animal has a chiropractic problem. But it's worth a shot. I truly believe in, there's something, the school that I went to, ACES in Texas, and one thing that they said was that they believe that every animal should have the benefit of adjustment once. And I truly believe that, because the changes that can come are so positive that it's undeniable that it has a place in veterinary care.
And I see it with our patients for sure. Now, you just touch a point that I want to dig into a little deeper. A chiropractic problem. What is that? What is a chiropractic problem?
Good question. You've all seen the commercials where you lay down on this little roller and it pops you back. It's supposed to replace chiropractic. Well, that's not a chiropractic problem. When a joint, the term that's used by a chiropractor is subluxation. It has loose definitions. Chiropractors don't even agree on the definition of a subluxation. There's different definitions. So it's hard to say, speaking for the entire profession, exactly what that is. But for me, it's something that would not resolve on its own through stretching, through massage, through an injection. Joints, you think of a skeleton, and like the one that you have, it's not symmetrical. It is not symmetrical. You can't say, well, it's moved strictly to the left. Well, there's more than one articulation there, and the shapes are different. And if that joint becomes locked hydraulically so it cannot move, the only thing that will restore that proper motion is an adjustment in the exact correct direction it'll take to relieve that pressure and to get that joint to move again and get the nerves to feel the joint properly, and so the body can control it and move it better. There's a part of the brain that controls those muscles that are fed by the nerves that are in that joint. And if that part of the brain can't feel what's going on there, it can't move right. And so you're not just putting a bone back into place, you're changing the way that the brain is able to interact with the environment and control everything.
That is what you just say right now. Is what opened my eyes about 13 years ago, because I was one of those that came out of vet school, right? And then I keep hearing, and later on, please clarify all these terms for me, but I kept hearing out of the sternum, out of the neck, is out of the pole, is out in the SI, it is out here, out there. And then when me as a relatively young veterinarian start thinking, okay, I just went through all this anatomy, 9 years of studying how if their joint is actually out of place, the horse should be crippled, extremely sick, and you just cannot fix that with a little manipulation. You just cannot do it. So what you just say makes a lot of sense. And can you then explain to me and our audience, what does it mean then when a chiropractor comes and tells us it's out of the pole, out of the SI? Because obviously it's a different nomenclature than what we use in anatomy, right? So
Yes. It's an oversimplification of an extremely complex organism. We don't even understand the full complexity of the human body as much as we'd like to give ourselves credit for. We really do not. And then trying to translate that to an animal, we can't feel what the horse feels. They're so sensitive. A fly lands in one spot on their back, and they can make that muscle move right there like a needle. And we don't understand that. The best way I can compare it is like when a man or a woman goes blind, their other senses become more sensitive. They are more sensitive in different ways than we are. And they communicate extremely well, but not how we communicate. And so to try to translate that complex system to another human that doesn't have the same training as you, sometimes people take the easy road and oversimplify it and say, it's out. It's out of place. It needs to be put back into place. It's a lot more complex. The whole system needs to work better. And that's what I mean by, interacting with the environment, helping the nervous system interact with the environment is a better description of what we do than it's out of place or it's out. But it's such a complex, the neurology, you could spend 10 years studying the neurology of how an adjustment affects the body and not even scratch a tenth of what actually is out there and what could be learned and studied. Like I said, we need more research.
that makes sense, and we need more research also on the anatomy and like you said, the proprioception of each joint, right? Makes perfect sense what you're talking about, and I hope that our audience have a much clearer understanding now of what does it mean when we say, oh, it's out here, it's out there. Because sometimes, about a week ago, I saw a case that radiographic had a subluxation of the pastern joint. When you see a radiographic subluxation, obviously it has been like that for a while, or some ligaments are torn, and a chiropractic adjustment is not going to bring that subluxation out if the ligaments are completely torn. And it was actually a little bit of a conversation because the owner was, oh, it's out, it's subluxated. We just need a chiropractor to put it back into place. And then that's what triggered me. I need to talk to the Burnham. We got to talk about this. We have to bring that into play. So talk to me what you do as a chiropractor. You see a horse extremely lame. You see a radiographically subluxated joint. What do you do? What is your course of action? What do you tell your clients to do?
Well, obviously, if we have the radiographs, it's already been seen by a veterinarian and cleared medically. Now, what I would do in that instance, like there's a torn suboccipital ligament, for example, you're not going to go in there and jump off the third rail, land on your knee, and make that thing pop. That'd be the worst thing you could absolutely do. People think that because horses are so much bigger than us that you have to use so much more force. And they hear these loud cracks and they see these YouTube videos. Honestly, most of my adjustments create no sounds. Most of them. Sometimes, yeah, I've heard some really loud ones. It's necessary. But I don't force it. The amount of force that I use, it's not how hard you hit with a baseball bat. It's a tap with a needle in the exact right direction. It's in the exact right position. And you don't have to slam it into place because it's not out of place. What you have to do is move the ligaments and the tendons and the muscles in just the right way to cause a reaction to occur in the spinal cord, relax the muscles, ease the pressure, and allow that joint to begin moving properly. And like when I have a human patient that hasn't been adjusted in a long time, they're in terrible pain. I'll use my fingertip, really, just my fingertip, and it works, and they get relief. But if you go in there, grab their head and put a microphone next to it and twist the bottle, and they're going to be hurting. And that's not the goal. Sometimes it's necessary to break up the calcification that happens in the ligaments. Sometimes you do need to go in there when they're in less pain later and do a more forceful adjustment. But you really just have to restore normal function to the joint and let it do its own thing. You don't have to be there and, yeah, I got a huge crack on that. You see that? That was awesome. That's for show. That's for YouTube. For actual medicine, you have to learn. It's more important to know when not to adjust in an animal and when to dose down thrust. That is more important than when to adjust. And that's why the education is so important, to really understand the neurology of what you're doing. It's not about the crack. It's not about how far it moves. It's not about looking cool on YouTube.
Thank you. It's very important to know when not to adjust. That's pretty cool coming from a chiropractor. I figure a chiropractor always wants to crack bones. So, we have a case right now. Well, we recently discharged a case right now that was supposed to be, we recently have discharged many cases, but this particular one that comes to my head is a horse that had an actual mechanical dysfunction, impairment, obviously. This particular horse was lacking the head of the femur, right? So this horse went to surgery. They did surgically, they removed the head of the femur, and you worked extensively on this particular horse. She was definitely not putting weight on it. And walk me through the process when you are working on a horse that is so lame, that is actually missing a part of his body. Is there a process that you follow? How do you approach a case like this? Because this horse, the change was obviously fantastic. The horse went home walking. The horse was happy. The client was happy. And it was one of those YouTube cases that you're mentioning. And we're probably going to make a sequel.
I'm not going to lie. I shed some tears on that one when she went home. That was incredible.
Yeah.
Absolutely incredible.
So talk to us, how was your rationale? How did you work on that horse who is obviously mechanically impaired?
Really, just had to give it a chance. And I felt the way that the horse, it was the right hind that it couldn't put down. So it'd lift its pelvis up, twist its full spine. And I knew that that would cause the nerves in the right side to not work as well, to not receive proper through the surgical process. Tissues were damaged that sent information to the brain, and the brain needed to be able to get as much information as possible from there to control that area to send information back. Remember, the gluteus muscle just simply wasn't there. And I knew that if I kept that pelvis as level as possible and helped keep the nerve functioning as highly as possible, that there was a chance. And it worked. And she's never going to be able to be a fully functioning, but it literally, there's very few cases where I can say it saved their lives, and I truly believe that this is one, because you can't have a three-legged horse.
Absolutely. Yes. No, you definitely saved this horse's life, and the impact not just on the horse, but the impact on the owner and the happiness that you brought to the owner is equally important, because then you're doing some good, not just for the horse, but also on the emotional aspect.
People think of animals as property. Some people think animals as family. For the people that think it's family, they're hats off to them for giving them a chance. They gave her a chance, and it worked. And I didn't. At one point, you told me, Dr. Burnham, we're going to have to send this horse over the rainbow. I said no.
Yeah.
It was a team effort.
Yep, that's very good. Now, there's another case that comes to my head that was also life-changing. This particular case is a more common case. Severe neck arthritis, severe back arthritis, and we work hand in hand with this horse. And this is one of those examples where the chiropractic veterinary caretaker relationship comes into play. And you were the one who referred the case to the clinic for actual radiograph and neck injections. So I want you to walk us through the process of how do you make the decision when you're in the field, because clients call you regularly to go and see the horse that maybe have never been seen by a veterinarian. How do you make the decision and you say, okay, this needs to go to the veterinarian and we need radiograph, and we also, how you make the decision on, oh, this is really bad, let's try to give it a chance. Walk me through that process so our clients know what happened, how it's possible, and how you can get this done.
Yes. A human patient of mine was going through some health challenges, and they were life-changing health challenges. And she had to figure out what to do, make sure that her horse would be taken care of, be able to live his life. And he was having some challenges of his own. She took him as a rescue, and he got injured after she took him. Never get weight on him. Didn't really tell me the full extent of how bad he was. So I asked her family to take a video of the horse so I could see it. And just off the video, the horse could barely, it labored just to take a step. And the horse was miserable. You could just see it in the video. And when it did step, it couldn't lift its hooves off the ground. And at that point, I knew that even if I helped it with an adjustment, that there was more going on than an adjustment alone could help. That we needed to make sure there wasn't cancer. We need to make sure that there wasn't a fracture. Go in and, try to adjust a fracture and make it worse. We really had to have a full workup, and it was extremely important because this was an off-track thoroughbred. And I wanted to have a chance to, before she passed, to be able to say that this horse is going to be taken care of for the rest of his life. And to do that, he's a gelding. He's 13 years old. The only thing a lame gelding really have as a job is a pasture companion. And that'd be hard to find somebody that'd be willing to take care of this horse for the rest of his life. There was a situation that occurred while we were going through this process in Ocala here. 16 horses were seized and taken over because they weren't being cared for. And the rescues were already full. I called every rescue that I could. I reached out to people in 4 different counties, tried to find a place, somebody to take this horse, and it simply was not available for a gelding. It was lame. And so to save his life, we had to fix him and give him a job. And thanks to you and the team and benefactors, people came together from 4 different counties, I realized, to help this horse. And we were successful because somebody stood up and gave this horse a chance. And he is being ridden right now in a rescue in Lake Helen.
Awesome.
He's being ridden, and he has a job for life.
And he's doing great.
Yeah.
This is one of those prime examples where this horse require medical attention and regular medical, our traditional joint injections, our traditional joint supplements, plus chiropractic work, because either one alone would not get this horse where he is.
Correct.
So it was a great example.
Medicine does not work against chiropractic. Chiropractic does not work against medicine. It needs to be dosed appropriately together. It works better together. We need the research on this. because you've seen and I've seen injections, chiropractic together, they get better. They get better.
They get better, and last longer. Yeah, absolutely. Well, Dr. Burnham, it has been a pleasure having you here in our show. I hope you guys have enjoyed and learned as much as me. I have taken a bunch of notes, and we're going to be reviewing this and learning how Dr. Burnham is demystifying the chiropractic work for us and for all our audience. Thank you very much. You guys have a great day.
Pleasure's all mine. Thank you.